23andMe.
Yes.
You're coming out of the pandemic. The consumer around the world is thinking a lot about their health. How's that helped you?
People, it's interesting. With COVID, it was the first time when we would publish articles that would actually drive sales. So COVID definitely spurred people to be hyper aware of health and definitely interested in what's going on. And 23andMe definitely saw a bump that people were interested in the research that we were doing, and people are definitely interested in health.
And as we enter this second half of 2022, and economies are opening, and many people are double vaccinated, boosted, are they still coming to you? What is their consciousness about health data?
I think people come to 23andMe. There's clearly half of our customers come for ancestry, and then another half definitely are very interested in the idea that they're empowered to take care of themselves, and they're empowered with information about prevention. And I think people have learned with the pandemic, there's obviously we think about masks, and we think about vaccines, all of that ties in with the world of prevention. So suddenly being able to tie that as well with saying, type 2 diabetes, are there things that you can actually do to prevent it? Are there actions that you can take? So lifestyle, environment, I think it all wraps in. People definitely start to think about that more and more. What can they do to just be healthier in general?
Let's go back to basics, 23andMe. Just run through what it is you offer and how it works.
23andMe, it's incredibly simple. You spit in a tube, we collect your DNA, and we help you interpret your DNA. And we're different than all the other companies out there in that we never said we're just ancestry, we're just health. We really wanted to have this holistic vision of we're about you and understanding your DNA. And DNA is fascinating. You share it with all this life around us. You and I are 99.5% the same. So how is it, can we understand the DNA to understand why we're different? Some people, are introverts, some people are extroverts, some people are high risk for type 2 diabetes, some people are not. How can we actually understand how the DNA influences all of that? So we return our ancestry results to people, and we return health results to people, and we engage them with their own personal DNA.
How many of these kits are you selling, and where are they doing best? Is it here in the United States? Is it in other markets? Where is there most engagement?
We're focused mostly on the US right now. We also sell in the UK, we sell in Canada, we sell in 66 countries, but we don't sell health everywhere. Health is still highly regulated in most of the world. So it's mostly in the US. We have, we still see, we see good uptake from our customers that are really interested in, again, both understanding ancestry and understanding health. And what's interesting is that there's a real tie-in. Most people can relate and say, okay, if you're of Jewish descent or if you're of African descent, you're potentially at higher risk for certain conditions.
Right.
So there's a real tie-in between the ancestry and what your health predispositions are.
You made an interesting acquisition, Lemonade, telehealth. It was another kind of big pandemic era hot ticket. How's that gone for you?
The reason why we bought Lemonade is very different than why other groups got into telehealth. It's not because we wanted to get into urgent care and strep throats and the whole telemedicine craze, but rather we saw suddenly this opportunity that people are comfortable talking to their clinicians online, and that frankly most clinicians are not trained on genomic medicine, meaning that if you go and you get your genetic results for Alzheimer's or chronic kidney disease or other conditions, most physicians today are not trained on what to do with that. And so 23andMe, by acquiring Lemonade, now has the opportunity to offer the full stack, meaning that I can give you access to a direct-to-consumer approved, FDA-cleared test. I can get you your genetic information, and now I can actually provide clinicians who are trained on genetic information and a pharmacy that is also trained on how your genetics interplay with medications. So I can offer now that full service to our customers.
That was a successful acquisition. What's missing? I mean, are you out there looking for similar opportunities to build out the 23andMe offering?
Well, acquisitions take a lot of time to integrate. So I would say the first step is the integration, but then really be able to start to train clinicians and provide those to our customers and provide that full package. People today still don't necessarily know what to do with all their genetic information. So there's a whole process for us of educating our customers. We're gonna give you healthcare providers now who can help you actually understand how do you actually potentially translate that into your life, and lots of ways that we can actually leverage the service to help encourage behavior change.
You're the CEO of a publicly traded company now. healthcare is important for consumers, but we're in a challenging inflationary environment. And we've been having a lot of discussions in the last 24 hours about where does the consumer stop spending? Do you think that the consumer will continue to assign importance to spending on healthcare data, monitoring, metrics? Or is that something that there's a risk that consumer spending slows down?
I think there's a couple interesting trends. So I think first off is people are really frustrated with the lack of transparency in healthcare, the surprise bills, and I think that there's definitely an encouragement. People want to have more control. And I think one thing that 23andMe has really led on is being a low-cost provider of information and making it really affordable and accessible. So I think more and more there's going to be a trend where people want to be in control. They want to know exactly what they're paying for, and they want to be able to know that they're actually getting a reasonably priced service. So I think that 23andMe at our current, $200 price for a health and ancestry kit, it's in that range of reasonable for people.
What is the Anne Wojcicki big picture outlook for the rest of this year and beyond?
Oh, well, for this year and beyond, I mean, I focus on beyond. So for me, I've always been very much focused on the long-term vision. And the long-term vision is a totally different type of healthcare system that is frankly about your best interest. Today's healthcare system makes money when you are sick and you go into the system. And so I've always been focused on a self-pay, direct-to-consumer model because my relationship is directly with you. How is it that I can win as a company and you can win as an individual if I can keep you healthier? So I really look at a world, how do I actually empower you to be healthy at 100? How do I empower you to be as healthy as you possibly can and not actually get sick to begin with?
Final question very quickly. Do you think 23andMe is seen as a potential partner for a bigger healthcare system or even a potential acquisition? Have you ever thought about doing that?
I think now that we've acquired Lemonade, and the focus that we have on genomic medicine and the delivery of medicine, I think that 23andMe could play a really important role in helping bridge consumers who actually have their genetic information with the rest of the medical world and how they're operating and start to bridge that genomic divide. Like help people actually understand what is this information, how to use it in a clinical setting, as well as how to use it in a lifestyle setting.